Okay. Work in general. Thank you, and thank you for joining us. If you can, Brother Muhammad, please share with us what this strike means. What are the realities of the folks who are incarcerated right now? What was it before the strike? And what is it now? How are folks able to eat? How are folks able to move around the facility? How are folks able to get the things that they need?
Okay, let's start with what this strike means. Just 3 years ago, the union negotiated a contract, a new contract, and they have a new contract. So what the strike means is that really in totality, they are using this as a tactic to repeal the Halt bill. The Halt bill is a bill that was passed that prevents them from putting someone in solitary confinement. In solitary confinement, when it was utilized, that was where all of the abuse occurred. Most of the murders occurred in solitary confinement. So they want that back. And they also are striking because now their colleagues has been held accountable for the death of someone that's incarcerated. This has never happened before in the past. And every time we got to this juncture where we're getting indictments, they would either cop out, plea out to preserve their pension. But this strike is trying to prevent the Halt bill and to take away the accountability of correctional officers now being arrested and indicted. What's happening inside? Unbearable conditions. There's no movement. There's no mental health services. The food that they're getting, if I can remember, they used to give us what, cheese sandwiches and bologna and milk. And you might not be getting that because there's no one there. The National Guard is there just as a what you call support. They're not trained in doing correctional officers' work. They don't know what's going on in the facility. Of course, they're going to be called you. They don't want to get caught up in the union and the politics of the New York State. They want to be neutral in this. They're following their orders. But what's happening also is that food supplies are being stopped and prevented from going into the facilities. So the men and women are really at what we call their diet end because they don't have any foods, they don't have any supplies. Tension's going to be high. The smell, the stench is going to be horrendous. People are going to really be at a breaking point. And they are now. Because after 2 weeks, if you don't have what you call we call our emergency supply, and people don't have what they call the survivor schools to cook and eat together and try to preserve and work with one another, it's just total chaos. It'll be another Attica. And we've been telling the commissioner for years that you have another Attica brewing under you. But it always has fallen on deaf ears. Even when we give them recommendations, it falls on deaf ears. So now we at the point where the people, the family, the loved ones, the formerly incarcerated, and then incarcerated is at their breaking point now. We've been what we call, and I like to say, historical traumatized when we've seen that video. Most of the men and women, when they come out, they really try to forget about those horrors. They really try to put that behind them. Unfortunately, when that video came out, many of the men and women were re-traumatized again. They were having nightmares again. This is why they're out. Because when we complained about these issues, it always fell on deaf ears. Now we have evidence. We don't have to continue to give our stories to be re-traumatized. Unfortunately, Mr. Robert Brooks' video, very, very, what I would say, horrendous, has proven our point and has given our evidence and credence to all of them complaints before Attica that this has gone on and continue to go on inside the New York State prisons and prisons throughout America. I know many of us have loved ones inside. We're worried. I'm worried. But we got what we call the people now, the people power. I've been doing this a while, but I have never seen this many people come out in support of what we're doing. Most people, like I said, they try to forget about this, and their family members don't know about this. But no one could be naive today and deny what they seen in that video, that was totally unnecessary and horrible. And this is everyday conditions and abuse in New York City and New York State prisons.
Can you share a little bit more in terms of what we're hearing is that it's likely to get worse, right? We're hearing that it'll get worse in different ways. Can you tell us in what ways do we need to prepare for it to get worse? What should we expect to see soon?
Brutal retaliation and reprisals. We will have to be in those counties monitoring the hospitals and the transfers that's going to be going on. It's going to be hundreds of transfers going on because they're going to try to break up the population and break up the unity amongst the men and women inside. The mental health population, they will be severely affected because they're off their meds now. And it's going to be hard for them to get on their meds. They're going to be very rebellious. Their cognitive skills going to be out of whack because they don't understand the rules as it is now. So they're really going to be a problem. You know, many of the guards is going to come in there vindictive because they're not going to get what they want. You know, so they don't blame the union. They don't blame the hierarchy. They always fall down on the person that's incarcerated. You're going to have some that's going to fight back. You're going to have an incarcerated population that's physically going to fight back because they're tired and sick and tired. I've been there. Regardless of what the circumstances may be or the outcome, they're going to fight. It's going to be a physical fight. And after a while, it's going to be a one-way fight because we don't have the ammunition to fight. But when you just get to the point where you don't want to have it no more, you're not taking it no more. And that's coming.
Thank you. Michelle?
Thank you, Mohammed, for giving us such a strong like a clarification of what can happen and what will happen if this continues. It's my honor to introduce Emma, who's a passionate advocate, a voice for families impacted by incarceration. Emma, your husband's tragic experience in the prison system highlights a devastating reality that far too many families face, where neglect and lack of medical attention can have a fatal consequence. Can you tell us about your loved one's experience and how his case reflects the broader systemic failures in providing adequate health care to incarcerated individuals?
Thank you, Michelle. First and foremost, good evening, everyone. I want to say thank you to AFJ for hosting this town hall. These conversations are so important to the community that are impacted by incarceration. The issues that incarcerated individuals and impacted family members have to deal with are immense. I feel that we are all caught up in this painful vice called the prison system. We need to come together and work together to create awareness in all aspects of what is happening to our loved ones while they are incarcerated. My husband, Emmanuel, was the love of my life. And he was tragically taken away from me due to the lack of medical care and post-care that he received, that was provided for him, I should say. The vision in my husband's left eye became blurred. When he noticed the change in his vision, he went through the proper channels of writing letters and going to sick call, waiting for a response. When he went to see the healthcare provider at the facility months later, he was turned away. The doctor saying that it was his glasses. And my husband has worn glasses all his life, and he tried to tell them that it wasn't the glasses, it was more so his vision. The doctor shooed him away, of course. And so he kept writing, and they finally took him to another exam. And of course, nothing showed. And one of the nurses was listening to him speak to the doctor, and she pulled him to the side and she said, "Tell me what your symptoms are." And that's when he explained what was going on. And she did some research and she said that, "I think it's your pituitary gland. So what we're going to do is we're going to send you to an outside trip." So they did that. They had an MRI for him. Lo and behold, she was right. He had a tumor that was pressing on his pituitary gland, that was pushing on his optic nerve, which was causing the blurred vision in his eye. So they went through the proper protocols to schedule surgery for him. Uh, we knew that the stay would be long, so we tried to speak to his counselor to get an idea of how we can schedule visits, telephone calls while he was recovering in the hospital. She told us that not to worry because I'm his health proxy, so I should have access to him while he's in the recovery. The last time I spoke to my husband was October 23rd, before they transported him to the hospital. They told me, they called me on the 23rd after the surgery, and they told me that it was a success. He's in recovery. I asked the nurse, "When can I speak to him to see how he's doing?" She said, "You can't speak to him." I said, "Well, I'm his health proxy. I should be able to speak to someone to know what's going on with his care." She said that the guard said to call the facility. The next day, I called the facility. They were of no help. They told me to call the hospital. And I told them the hospital told me to call you. And also, I spoke to a counselor and I said, "You told us that we would be able to speak to each other." She didn't say anything. She just said, "Sorry, can't help." I tried all my resources trying to find a way to speak to my husband, trying to visit my husband. I called Albany. No one was able to help me, or they didn't want to help me. I received a call on the 25th of October. The doctor calls me and tells me that my husband became unresponsive and they're starting chest compressions, and that I need to make my way to Albany. Albany is a 4-hour, 5-hour ride for me. And I asked, please do what you can. And the doctor says, "Don't worry, we're going to do everything we can. It doesn't matter that he's incarcerated." And they hung up. Um, I'm speeding down the highway and I get a call 40 minutes later, and they tell me that they've been doing compressions for 40 minutes. I asked if there was a pulse, if there was brain activity. They said no. And I said, "Please stop compressions." I got to the hospital and visiting hours were closed, of course. So they wouldn't let me see him. I had to basically raise hell in order to see my husband. There was a white shirt there. He said, "Let her through." And I was able to spend 30 minutes with him. I was not greeted by a doctor. I was not given any condolences, "Mrs. Pierre, this is what happened to your husband." To this day, I still don't know what happened to my husband. If it wasn't for the coroner that spoke to me the following day, I would not know how he passed, what was going on with him, nothing at all. So sadly enough, I know there are more stories such as my husband's, and I want to bring light to this. The death of my husband leaves me with many unanswered questions. If they had correctly diagnosed him earlier, would he still be here? If he received proper post-op care, would he still be here? If he was not a Black man, would he still be here? And if he was not incarcerated, would he still be here? These are the questions that I myself, day by day, day in and day out, I grapple with. So there is a systemic failure in the medical care provided to our loved ones. The Department of Corrections and healthcare providers, they have to be held accountable because our loved ones are the ones under their care, which is why these conversations are so important to have. Because incarcerated individuals and family members, we go through so much. And sometimes the feeling of helplessness can take over, but we still have to try and fight. I try to use my platform to help others and to raise awareness. So I'm grateful for this community because it's going to make a change. It's going to make a difference because no one should have to go through this horrible experience.
Thank you so much, Emma, for sharing. And my condolences again. As an advocate working closely with families affected by the incarceration system, what have you witnessed in terms of their struggles for adequate health care with this ongoing strikes? Like, what are families sharing with you about the current conditions and their concerns for their loved ones inside?
From what I'm gathering, there's a sense of hopelessness. There are a few deaths that have been reported recently due to medical neglect. A lot of people, unfortunately, they don't want to go to the hospital or go to the facility hospital because they're just going to give them ibuprofen and send them along their way. And some people, unfortunately, they do self-medicate to help with that pain or whatever they're dealing with. There's a lack of insensitivity that these providers provide to our loved ones, that they don't care. They don't take the time to listen to the things that they're going through or what they're feeling. And it's very disheartening because I feel that as a medical provider, your vow is to do no harm, but they're causing more harm. And it's just they're discouraged. A lot of people are really discouraged because unfortunately, yes, they're striking, but our loved ones are paying for what's going on. And with the news of perhaps Governor Kathy Hochul maybe transporting loved ones to different facilities out of state, that is a concern for me, and I'm sure to everyone else that might have a family or loved one inside, because I could put myself in my shoes if my husband was transported in a different state and he had to do this surgery. How would have gotten to where, let's say, Atlanta or any other state they might transport him to, not knowing what's going on with him. It brings me back to COVID when, we weren't allowed to, see our loved ones. So it might not be on the same lines, but the gravity is still the same. We're being taken away once again from our loved ones. And this is dangerous times. And our voices need to be heard. We need to speak up for our loved ones, and our stories have to be told. We have to stand up together. We have to spread this word. We have to rally, because if people lose hope, they lose everything. And people are losing hope, and we have to try to provide that for them. Thank you.
I couldn't agree with you anymore, Emma. That was definitely right, spot on. We're gonna redirect to Jamel. Jamel, having experienced incarceration yourself and with loved ones still inside, you have a unique perspective on the realities of the system. Can you share with what you witnessed in terms of the injustice of the system while you were incarcerated and what your loved ones are currently experiencing?
For the audience, I did 37 and a half years in prison, in New York State prison, straight 37 and a half years. And when I was there, I'll tell you a story so you can understand what my experience looked like and was like during the course of my incarceration. My first stop upstate was Attica Correctional Facility. I was there 1 week. before a man was going home, and he had to pass through A block, and he got into an argument with the officer while he was going home, heading out the door, because A block is the front of the jail, and he never made it home. They choked him. He got put him in a chokehold and killed him in A block. And this is the mentality of most prisons upstate. They don't view us as human beings. And so this is my first encounter with being upstate, 1 week, and they murdered a man on his way going home. Because back then, A block in Attica Correctional Facility, for those of you who don't know, was called South Africa. And I'm talking about 1987. And it's still South Africa. And to put it in perspective, there was an officer that I used to work for in the mess hall. He came into work one day distraught, and he was acting all crazy. And he said, listen, I said, what's the matter with you? He said, they telling me I have to go work in A block, and these are the things that I must do when I'm in A block. And that's mean be disrespectful, brutal, demeaning, and abusive. And that was totally out of his character. And he didn't want to go to work in A block the next day. So he banged out and didn't come to work because he didn't want to work in that block. And that is indicative of my experience, through most of my experience throughout my incarceration, dealing with going to these different prisons like Clinton, Attica. The mindset and the culture of the officers inside those prisons is that it's us against them, and that we are the scum of the earth. And they treat us like that. That we're supposed to, they say that we're criminals, all these labels and titles on us, and they say that we're the scum of the earth. And they brutalize us because they feel that they can get away with it because they never has been held accountable for their actions. As Muhammad said, most often they're not charged, indicted, or anything. They are allowed to resign and accept their pension. And right now, they're claiming that the conditions are unsafe. And I say that the conditions are unsafe because you made it that way. You create this atmosphere. You try to rile up the population to make them get to such a point where you put their back against the wall, where they have no choice but to respond in the way that they, just to call for human dignity, and then use that to justify all the repressive stuff you want to put in. Yeah, they're calling for the repeal of HALT, and they also calling for the demand that there be no more in-person visits, because they're claiming that it's the visitors bringing in the drugs. But when we look at it and examine, all we had to do is go back to COVID, when all visitation was stopped. Who was bringing in the drugs? How was the drugs still getting in the prison system? The prison system was being flooded with drugs. So who was bringing in? No visitors was coming in. So how could you say the visitors are bringing in drugs and you want to stop in-person visits? So my experience throughout, and that's the negative side, because a lot of us like me, Terrell, and many of us that did time, we took it upon ourselves. We don't believe in the concept of rehabilitation. We talk about empowerment, that we empowered ourselves, that we said that when we left prison, we was going to leave prison in a better condition than when we came in. We wasn't going to sit in there and just allow, as they say, allow the time to do you. No, we did the time, but we did the time in a way that it benefited us and it benefited our community, even under those brutal conditions of the way them officers treated us and the way they looked at us and the way they murdered and brutalized other individuals that was there with us. Fortunately, we made it out. And that was very fortunate for the type of time that we did in that system. We made it out. But there's countless others that's not making it out. Right now, during the course of these little 10, 12 days, how many days they've been on strike? We done lost 3 men that we know of. We don't even know everything that's going inside the women's prisons right now. But we know we lost 3 individuals, one in Auburn and 2 in Sing Sing just recently. So when we talk about, and I'm gonna just wrap it up, like I know you got another question for me, but I want us to understand something. Sophia said they breaking the law, the Taylor law. So we need to understand this. What they actually did, yeah, they breaking the Taylor law, they violating that law, but this is something even more vicious that they did. They locked individuals in their cells, and then they walked off the job. You locked individuals in their cell where they have no movement, they can't do nothing. They totally dependent on you, and you walked off the job. That is cruel and unusual punishment. Right now, we calling for the governor to start using her clemency power. Forget about sending people to other states. Use your clemency power and start releasing people. You done shipped everybody out of Collins Correctional Facility. Close that prison down. There's nobody there now. Close it down.
Jamel, given the heavy emotional and mental toll that both your past experiences and your ongoing advocacy for incarcerated loved ones, how do you find time to take care of yourself? Like, what are some ways that you prioritize relaxation and personal well-being for yourself?
Michelle, that is a heavy, heavy, heavy question because everybody, every time they see me, they always saying, go lay down, go get some sleep, you need rest. But I can't find rest. I can't find it because one, I'm an impacted family member. I still have a brother that's sitting in prison that went to prison when he was 20, and 4 months from now, he's going to turn 60, and he's not going to be able to go to a parole board until he's 78 years old. The likelihood of him, based on the medical treatment and all the stuff, the anxiety that we go through in there, the likelihood of him making it to 78 years old under those conditions is very, very, it's questionable. But when you say, what do I do? It's hard. I try to take at least one day off, like Sunday sometimes, but I wind up working on Sunday anyway. Somebody call me and say, we need you over here. We need you to go somewhere. We need you somewhere. And I'm going to go because, again, I know what we left behind in that prison. And I'm not going to get any rest until I get enough of them brothers home out in the community. So some of them, hopefully they're younger than me, where they can pick up the slack, and then I can get some rest. Once we bring them home, then I can get some rest. But right now, relaxation is not in my vocabulary. And I keep telling people I have a social life, but they don't want to hear that. So that life suffers too. But somebody told me, you know what you signed up for. And that's just what it is. We know what we signed up for. And I signed up for this.
I know we were supposed to just give you two, but if you don't mind, I have another question for you, brother. Can you talk a little bit about some of the tools that you all are using, you individually, but also RAP institutionally, in terms of advancing some of the work that you're doing? I had an opportunity to hear you speak early this morning, and that was a program where you actually talked about the utilization of art. Can you
Yes.
talk a little bit about that and RAP's collaboration with some of the art institutions and how that's moving your work in a very tangible way?
And I think we use at an event that they call with Broadway Advocacy Coalition. They actors and they put on plays, and not just that, they do a lot. And me understanding as a writer, a published author, that art in its unique form is that it is influenced. We hear hip hop, we hear movies, we see movies, and we, based on the visual of what we see, sometimes it can get the message across far quicker than me standing up there giving a speech. When somebody can see something in place, see something in action, and then they can interpret it based on what they're seeing, it moves the needle a lot further sometimes than just somebody talking and giving a speech. In rap, what we do, we basically we knock on doors, we canvas, we go into the community, we go wherever we need to go to talk to people to get them to understand, what is going on. Because too often we assume that people understand the system and they understand, the laws, how bills become whatever. We assume it, and then when we take the issue to them, even some of them CO's family members that was up there protesting and storming, I had a conversation with two of them, and the first question I asked them, have you ever worked inside of a correctional facility? And they said, no. I said, so where are you getting all your information from? My husband. I said, okay, well, now I'm going to tell you the other side. And I talked about the culture and all the stuff that takes place. Even if your husband not involved, they stuck in that culture, and that culture dictate that they act a certain way. And so we use art. And I think I told the story about how I stopped the violence for a little while with the SEALs beating up the men in Sullivan Correctional Facility just by writing a story called Prison Songs that talked about how the men that was released came back and did all that vicious stuff they was talking about they was going to do, and they did it. And I made it so vicious that it scared up everybody. And all the officers wanted to prove to me and the other incarcerated people that they wasn't like the characters in my story. They wasn't them. And so that stopped the beating up for a little while until they went back to their old ways, and they wound up killing a man named Mr. Taylor over there. And it was, same old, same old.
Thank you for that. I wanted to ask you to stick around. We're going to take some questions from the audience, and I'm again inviting audience members to please start posting your questions in the Q&A chat. We have a few more remarks that we're going to get from some of our panelists. We're going to take some questions from you, and then we're going to give you some marching orders. We are not having this conversation for the sake of talking. We are informing ourselves, and then we're actually going to be giving you all directions on how to engage. And as I look in the attendee list, most of the people here are already engaged, and I'm glad to see all of these familiar names here. And for those who are not familiar, we're glad to have you, and we welcome you. So I'm going to bring Sophia Elijah back to the stage. And if you can, Sister Sophia, I'm going to ask you to talk a little bit about, or at least make the connection with these issues that we're talking about today, particularly here in New York State, with its relationship to what's happening nationally, particularly with the changes that have happened with the new and incoming administration. We are looking at some moments that I know this word has been used quite frequently over the past few years, but I think it's appropriate. Some unprecedented kinds of movements. But what are some of the connections that we are seeing?
Thank you, Lumumba. As I was listening to the panelists, particularly what Jamel and Muhammad were talking about, I was really reflecting on a tribunal that I did some years ago after Katrina, and how the people who were trying to survive, to escape the flood in Katrina, were mistreated, particularly what happened in the prisons, because something similar happened. The people who were incarcerated in the Ninth Ward were left locked in their cells as the water was flooding the facility, and the staff walked away, left them there to die. And as I was listening to the comments tonight, it reminded me of that same kind of chilling effect. And in some ways, it was a dry run, because the response, quote unquote, from society and from the White House and across this country was complete callous disregard for those lives that were lost and the families who were traumatized by what was happening to their loved ones. There were no rescue teams going in to save people. They literally died drowning in those cells. And in similar ways, people are left to die in these cells here in New York State. So that's the first connection that I want to make. And the dots are connected to the callous disregard for human life that we see in this. I hate to use the word administration, but I have to say it because they're the ones who are wreaking complete havoc on the lives, not only of the people that they clearly aim their racist attacks on, but other poor and marginalized whites and people who've migrated to this country looking for safety, and anybody who they don't consider part of the, I guess, the 1%. So you see a gutting of Medicaid. Medical conditions inside the prisons were already laughable. Nobody inside ever thinks that dental care is something that's coming. I mean, people come out of prison all the time with horrific dental presentations because they didn't get any kind of decent medical care or any decent dental care, and that has a long-term effect. So we see a connection between what is happening on the largest scale nationally, but the trial run is the callous disregard for the lives of people who are behind bars. And so that is spreading like a cancer across this country, and it's coming in a shock and awe kind of way. And many people who even voted for the current administration are shocked because they didn't think that they would get caught up in this tsunami of callous disregard for human life. So those are some of the connections that I can make, and I'm sure I can go a lot deeper, like getting rid of vaccinations. Not long ago, they cut the ability of women on Medicaid to get certain kind of mammogram and ultrasonic follow-ups if they showed to have a lump in their breast. So there's been a steady rollback of any kind of services or any kind of humanity. The so-called leader in human rights across the globe is laughable.
Thank you for that. There are a few questions here from the audience, and the first actually is connected to my question to you, and I'm going to bring the rest of the panelists back up so that we can all have a collective conversation. Again, we're taking questions only by chat, so if you can just put it in the Q&A chat. The first question is from Ray. Has there ever been a reason from these officers for their the language used here is MAGA behavior towards Mr. Brooks? Anybody want to take that? Mohammed?
There's really no reason. As Jamel was talking about the culture and the mindset of those officers that work up there. When you work in an environment that's a rural environment, and the only time you see Black and Latino people is either on TV or in your facility, you're not going to have what you call a decent social interaction. And the power dynamics play itself in that type of way. You know, unfortunately, that's where the prisons are at, in rural white areas. And those who get the jobs to work in there are the white folks that live in rural white areas. So they're gonna bring their cultural norms to work. Let's not be naive about this. Racism is the #1 problem we have on this planet. And it definitely shows its ugly head in the prison system. So, that's where we're at. I don't make bones. I don't try to speak diplomatic. I try to speak straight words so that we definitely have an understanding.
Can I add
Got it.
on real quick, Lumumba, real
Please do, and I have a follow-up before we move on to the next question. Go ahead, Jamel.
Some years ago, I think in the 90s, it might have been the 90s, there was a court ruling that came out that said that the KKK can work in the prison system as long as they don't bring their ideology into the prison system, into their job. But we know that's not how it is. They bring that ideology with them to work.
Got it. And that's actually my next follow-up question. We know that across the country right now, there is a move to almost allow those kinds of organizational and historically racist moves and issues and kind of images and things to be allowed and almost encouraged. So what we know is in our communities, those things exist not only by way of police department, not only by way of, policies, but can you all talk about how that shows up in the actual facilities? We know Attica and many of these places are sundown towns, right? And so while there are a number of initiatives that are well underway, as they should be, to help defend our communities from these policies that are happening nationwide, can you talk about the vulnerability of our folks inside who won't be able to access those kinds of mechanisms that are being organized?
You want to start, Jamel?
I'm gonna let you go first, and then I'll follow up on you.
With this present presidential administration, what's actually going to happen inside? You're going to see more repressive policies. As Jamel said, they're looking to stop personal and contact visits. They're going to Xerox your mail. You won't even be able to receive a letter, the smell of perfume on the letter. Forget packages. Medical conditions. That's going to be gutted because we have lack of medical conditions there for real. in order just to go to sick or to be seen, that would probably be put out. The feeling and the mindset of feeling emboldened because you have this type of administration that you can now be more brutal. And you can do it with impunity because you have the administration behind you. That's the type of stuff that's going to come. And be mindful that throughout the 70s and 80s, law enforcement had been infiltrated by racist organizations. This is a known fact by the FBI. So all of that, with this presidential election and this administration, is going to come to the forefront. Jamel.
Thank you. Jamel?
I'm gonna just go a little bit with Terrell just said. We know that, it's been going on for decades and years, and I think you laid it out how we have been complaining and saying that these are the conditions. The Correctional Association is supposed to have put out a report. We've been saying it's been going on, and they have allowed it to go on. And now with this current administration, everybody's coming out the woodworks, and we have to be very careful and be strategic in what we're going to do, because if they ever pass the law that they give them absolute immunity, what we saw with Robert Brooks is going not although it is a norm, they're not going to care that it's on video, because they can't get held responsible for it. They have absolute immunity, and that's what we have to be careful about with this administration. This is new administration, how these policies, how the attitude, and how we talk about people on the inside. For us on the outside, and I've been saying this everywhere I go, Lumumba, for us, there's certain terms and languages that we should never use when we're talking about our incarcerated brothers and sisters. I don't care who's talking to us, but the minute they use this word inmate, I'm stopping them. And that's just like I'm stopping anybody who ever calls me the N-word. I stop him, and it could be a brother, and he's not saying it in a negative way, but I'm not going to allow you to call me that. Because when you call me that, there's denotations and connotations that go along with that word. And the same thing applied to that term inmate. And we should stop letting people talk about our family members and incarcerated people as inmates. And that's really what we need to look at too, because if you can call them inmates, you can call them animals, then you can treat them like animals. And that's the danger that they face every day. And it's a shame that incarcerated people has less rights than pets and animals in the free world. So that's what we talk about this administration that we got to be careful about, because we're allowing them to define our incarcerated brothers and sisters as animals. And they are far from that.
Also, the prison population will go up. That will definitely be a reflection of the mindset and attitudes of this administration.
Undoubtedly. Thank you. Michelle?
The next one is not a question, more so a remark for Emma. Emma from Laura, from Rap. Shout out to Rap. Just to convey that the love and embrace of those, to convey Emma the love and embrace of those of us watching. She has a heart in every sense of the word. Condolences and love to Emma, to Graham, and to all of the families. Thank you, Laura.
Thank you. Thank you, Laura. Thank you. Thank you to my rap family. Thank you, Laura. Thank you, Susie. You guys have been a pillar for me, and I appreciate you all. Thank you.
Let's see. A question from Eddie. What is the connection between staff and politicians calling our incarcerated people animals and violence?
Let me jump on that first, Terrell. A lot of these politicians that's using those terms, these correctional facilities are in their legislative districts. These individuals vote them in the office. So they're going to speak supposedly, you know, we say leaders supposed to speak the aspiration of the people. These individuals come from their community. So they're a reflection of how these individuals in their community feel about our incarcerated brothers and sisters. And by calling them animals, they can get away with saying they have created a violent atmosphere in prison. All the problems that dealing with in prison is based on the incarcerated people there, not the officers. We are civilized. We are the ones that's doing the right thing. They're animals. Therefore, we should be allowed to treat them the way we want to treat them. And we can't allow that to happen.
As Jamel said, that's their representatives from that community. And they still have those same mores and norms because they're from that community. So they support that. But in calling someone an animal or derogatory term, you know, that's incarcerated, it just helps to reinforce the racism. And it helps people to see a person as a thing. As Jamel said previously, if I can call you an inmate and continue to do so, then I'm taking away your humanity and I can't see you as a human being. And eventually I'm gonna start treating you like a thing. And you know how we treat things. We forget things, we lose things, we destroy things, we kick things, we're abusive with things. And that's what's going to happen.
Thank you. There's a few questions here. We're going to take a few of them together, and then, well, actually, I'll just do this one, and a few of them are somewhat connected. But a question by way of Laura Whitehorn again, but from a formerly incarcerated man, asks, how can we change the dynamic to emphasize that it's the COs and higher ranking members of facility staff who are the abusers and cover-up artists, as opposed to the incarcerated people in terms of the bad apple moniker?
You first, Tara, or anybody? I can jump on that one too, Lamama. I asked a question in one of the chats, one of my chats earlier today was that, and it was on a correctional officer's CO chat, whatever they chat, not chat, some I just jumped on there. And the question I asked that in the last 20 years, how many officers have been murdered and brutally beaten and murdered by incarcerated people in the last 20 years? I just gave the last 20 years. And the answer is no, none. But then I said, go ahead and do your research and find out how many incarcerated people has been beaten and brutally murdered. How many incarcerated people has committed suicide to get away from the torture of solitary confinement? How many incarcerated people have died because of a lack of medical attention? If anybody was to ever really do the research and look at that, and just in the last 20 years, them numbers will speak for themselves. You will see who is the real criminal and the real one causing all the havoc inside of the correction, the so-called prison facilities.
You know, many of the people who's formerly incarcerated could be instrumental in that. If they just participate more rigorously in the organizations and go to the Albany, to the legislators' offices, and then just be themselves. Because you're going to be a reflection of what you're talking about. If we're talking about second chance, you're a reflection of that because you're taking advantage of your second chance. If we're talking about releasing aging people from prison, I'm 65. And I can tell them about that. How I came out as a middle-aged man. See, those of us who's formerly incarcerated, it should be incumbent upon us to be able to, what I would call, pull that narrative out to show that it's not really us. That those of us that's out here, in spite of those conditions, we sought to change our lives and change the conditions and be on this battlefield. It's up to us because we're the examples. This is why I'm in this game, because I'm tired of being stereotyped. I really am tired of that. So I'm not going to be the norm. And most people who know me know that for me to do this is something that they would never believe that I would be doing. because I lived another life on the inside. So for me to be doing this work and them see me doing this work, it's like, yo, this guy's, if he out here doing this work, man, we better get our act together. Because this wasn't what I was about at one time. But I'm about it for real.
Thank you. Michelle.
The next question I'd say is from Victor. What are some of the ways our communities can be empowered to make concrete systemic changes? I don't know if Sophia, do you have a take on that one? I'd say that would be directed to you.
I definitely have a take on that. And it really speaks to really the genesis of AFJ. Just like Muhammad and Jamel has shared tonight, you can see the amazing leadership ability that they bring despite all the trauma that they have experienced. And so I urge people to step up to the plate, like they said. First, deal with the healing, because that's key. If you don't heal, then you won't be able to be in this marathon fight for justice. But once you do that, just like many family members who are involved with AFJ, get involved, because there's strength in numbers. This is like the secret in plain sight. So many people, not just in Black and brown communities, in white communities too, their lives are impacted by incarceration, but it's the secret that nobody speaks about. But unless we come literally out of the closet and band together and stop these injustices, just like I spoke about earlier, the trial run is the abuse of people behind bars. But the bigger picture is the abuse of people out in society. You saw that with the way the police responded to protests in the streets after George Floyd was murdered. You see that in the way campus police are going after protesters on campus. We're going to see that more and more. So as we were told a long time ago, if they come for me in the morning, they're going to come for you at night. So we have to step up and understand what we're dealing with. So please get involved.
Thank you. There's a message here from Comandante Jose Saldana. What message do we give the incarcerated people facing retaliation from the prison guards who will resort to illegal action to get what they want? Jamel, I see you teed up.
Before we give the message, we have to have the resources. We need attorneys. We need attorneys. We need attorneys that's willing for pro bono to go in, to handle those tier 3s, to handle the lawsuits, and then we can give them insurance. Because that's what they're going to need. I would like to go with those type of resources before I give them any insurance. That's what we need. We need people who are in the legal field to really step up and give us their resources and their skills for pro bono for a just cause. Because these men are going to need it. And these women are going to need it for real. Because there's going to be a lot of abuse going down. And they're going to need that type of help.
The bomber. Now I had conversations with a couple of individuals in several different prisons, and you know, and it's hard for me to say it on the outside to them on the inside, to tell them to hold their head when I know what's coming. Because if they don't hold their head, you know, the way they're going to spend everything they do to them is that, you know, it's them. Even though we know they was antagonized, they was pushed to the brink to act. But I've been telling them, please hold their head, because right now we out here fighting, and right now we have standing, because everybody saw that video. Everybody saw that video, and all the stuff we've been saying for years is coming out, and we have standing. And there's going to be pro bono lawyers stepping up. There's going to be people stepping up. But the hardest thing for them to do is to hold their head. And right now, I'm asking them brothers on there inside to put their petty beef to the side and unite. Stand as one. Take care of one another. You know, start recognizing that as long as y'all take care of yourself and make sure that everybody in there is all right. If I'm eating and somebody don't have no food, make sure he eats too. Let's unite in there. But you have to hold your head, because they're going to come. We know the repression that's coming. When they come back in, when they go back in and they don't get what they want right now, they're going to go in there and they're going to be more abusive and oppressive than they have ever been in the last couple of years, because they're going to push them and push them and push them and push them until they get them to fight back. And once they do, I'm talking about physically fight back. And once they do, they're going to blame it all on the incarcerated people. So that's my message to them right now, Jose. I'm telling them, we out here fighting. Let us fight for you. Let us do the fighting right now. Let all the because since Robert Brooks was killed, I have not seen so many of my brothers come out that was sitting on the sideline. We call this our George Floyd moment. We call this our George Floyd moment. And we're out here in the streets fighting for you right now. And we coming out. And so I'm telling them to hold their head. And that's the message I'm giving to them. Please hold your head. Please don't let them use you, to say that y'all are violent, y'all doing all this when we know what's going on. Let us fight for y'all now, please.
Thank you so much for that, Jamel. The common theme here is unity. That's really what it sounds like. We got to stick together. So this is from Kimmy. As we know, the National Guard and the CERT team are inside of these facilities. My husband has reported that they are not wearing their body cams. Are they mandated to wear the body-worn cameras? Sophie, I don't know if you could speak to that. Do we know that if they
Certainly.
have to?
I can speak to that. There's a directive that came down from the commissioner right after Mr. Brooks was murdered, saying that they were all directed to wear their body cameras, not only to wear them, but to have them activated and running in any encounter that they have, any conversation they have with an incarcerated person. But let's just be clear. All right. These people are the walking embodiment of lawlessness. So they couldn't care less about a directive from the commissioner. And let's understand, the commissioner is a career corrections person, and several of his family members are career corrections people. And many of these atrocities have been going on his watch for a long time. And when Governor Hochul made the decision to appoint him to be the head of corrections, many of us spoke up and tried to expose the atrocities that have been happening on his watch for a long time. So this is the person that is so-called negotiating with the corrections union as we speak. All right. So back to your main question, yes, they're mandated to wear those cameras. They couldn't care less.
Sophia, I'm going to give you a follow-up to that because some of what I'm reminded of are some of the reasons why these cameras are. Can you talk a little bit about George Williams and his case and the impact it had on the work that AFJ has been doing?
Certainly. For those of you who don't know, George Williams was a man who was incarcerated in Attica. He was due to go home in about 2 months. This was back, I think, in Muhammad, help me with this. I got the date wrong. I think it was around 2011 or 12 when this happened to Mr.
2000.
Thank you. So Mr. Williams was taken out of his cell by a group of guards and beaten mercilessly. They broke several bones in his legs, his shoulder, eye socket, punctured a lung. They beat him so badly that the calls that we were getting, and I was at that time the head of the Correctional Association, was that someone had been murdered in Attica. Mr. Williams was taken to the he was taken by these guards to the box, to solitary confinement. The officer who was in charge of solitary at that time refused to admit him in there because he didn't want to be held responsible for the condition in which this man was brought there. So these guards then begrudgingly dragged Mr. Williams to the infirmary. Now, what usually happens in the infirmary is what we saw happen to Mr. Brooks, all right? They decided to beat him in the infirmary, and a nurse who was new on duty, she had just been on duty, I think maybe 2 weeks. She was new to the job. Not knowing what the drill was, she saw the condition of Mr. Williams, and immediately called 911. And so the EMT responded. When the guards who had beaten Mr. Williams saw that she called 911, they started cursing her out. Okay. They made her life a living hell, such that the woman finally left her job and took a job as a waitress in a local diner. Well, this was a diner where many of these COs frequented. When they found out that she was working at that diner, they threatened the diner owner that they would burn his establishment to the ground if she continued to work there, and then she lost her job. That is the mentality of upstate New York and these regions where these prisons are located. So it's no surprise that the striking guards would then take a transport bus just recently and burn it to a crisp in broad daylight, and not one of them is charged with arson. It's no surprise that the guards who beat Mr. Brooks to death on camera were not charged or arrested for 2.5 months. I'm a criminal defense lawyer. I've never had a client who was charged with murder who wasn't arrested immediately. But 2.5 months and then released on bail for $250,000, unheard of. But that is the double standard.
Just to throw this in there, as in regards to I'm Jayette. I'm just putting your comments together as a question. Do we know for the people who are suffering with mental health disabilities inside, are they being abused and neglected? Do we know if like everyone's receiving their meds? Have we heard otherwise, Sophia?
So, as I think Muhammad made the point, many people are just locked in their cells and they're not getting the meds. The people who are getting meds are being brought meds by people for whom that is not their regular job. People are getting the wrong meds. If people who need meds to maintain their mental stability haven't received them for 2 weeks and then all of a sudden they get them, that causes all kinds of other disruptions in their mental stability. And I also will say, in response to Jayette's question, historically, we have seen that the first people that the guards pick on and beat to death are people on the mental health units, because they will immediately claim that they were attacked by the people who are on that unit. And as a society, we have proven that we don't care about people who have mental health needs.
Also, it's kind of hard for them to comprehend all that what's going on.
Right.
And because of that, an officer would just say, hey, stupid, I told you to go in your cell. Or, hey, stupid, I told you to sit down. That type of abuse will become rampant. You know, they are the first to be abused. And they really don't have nobody to protect them. No one. They're the most violent.
If I could give an example, Carl Taylor, who was murdered by guards at at Sullivan, this is what happened to him. Every day, the officer on the mental health unit where Mr. Taylor was would find ways to taunt him. And one of the things he would do is he would throw a lit cigarette in the cell and have his cell catch on fire. And then he'd go get the fire extinguisher and destroy everything that was in Mr. Taylor's cell. And he would do this day after day after day. And then one day he ordered Mr. Taylor out of his cell, and he took and told him to stand and put his hands on the wall. And then he took his nightstick, billy club, and started beating Mr. Taylor in the back of his head over and over and over again, as if he wasn't supposed to turn around and defend himself. And as soon as he did that, this guy hit the the body alarm, and a bunch of goons, otherwise known as COs, came and beat Mr. Taylor and strangled him to death. And that case went to court, and they one after another got on the witness stand and lied about what had happened to Mr. Taylor, until then the medical examiner talked about the proof of asphyxiation, which clearly Mr. Taylor had not done to himself. And in fact, that case is what resulted in body cams being introduced across the system.
And they allowed those officers to resign.
That's correct.
I was there for that.
Similarly with what happened to Mr. Williams, those officers were allowed to resign and keep their pensions.
All right, I'm sorry, go ahead. Go ahead, Michelle, you got it.
I was gonna read Eddie's question. This wildcat strike is illegal. Why hasn't media called this out? And what is our role in changing this narrative?
Eddie, the media, well, some of the people in the media are calling it out. It's just that we're not seeing much of it on the national news as much as we would like, but they are. There's reporters out there that's actually reporting and asking us questions because we're talking to reporters. We're out there in the streets and they reporting on our actions and they taking our voices and they listening to our statements, but it's just not, we and what you see with the strike is because these people live up there. So they out there every day. We have to go home and come back to the cities and our little communities. So they don't see us as often as they see them, but they are putting it out there that, this is a legal strike and we're trying to get our message across and we need to get it across and everybody needs to get on the same page and start delivering the same type of message that this is a legal strike and that these are the conditions that this strike is causing. And because of them, when we talk about the 3 individuals that just passed away, this is on your hands. This blood is on your hands. They died because of the nonsense that y'all doing.
Traditional media has never gave us what we call positive or fair or truthful coverage. Never. I don't expect them to do so now. But because we have what you call now social media, and we have alternate media, our stories are getting out there. That's what you need to look at. If you're looking for the Post, the Times, the Daily News, those are what I would call institutional media that's going to just continue to quote the status quo. Those people that's in prison, they're animals, and they shouldn't be held with no regard. That's going to be there, and they're going to use the word in their articles always inmate. And we don't have meetings with them, their editorial boards, and explain why this terminology shouldn't be used. But they use it anyway. So we understand that regardless of what we do, it could be plain out murder like in Attica when they killed everybody in the yard. And they would still give you an alternate biased viewpoint of news. So don't look for that there. Believe me, we got new sources of news. Seek that out. Get a webpage. You create some news and tell the truth. We ain't got to depend on these people because they're not going to do it. I would never expect the traditional newspaper to tell what's actually happened and give us what I call favorable view. No, not in a million years.
Mm-hmm. Thank you all for that. The last question we're going to take is from Laura Whitehorn. And before we do that, just you all, before you log off, we have some marching orders. We're going to ask y'all to give us a few minutes because Brother Muhammad is going to share a list of things that you all can and should do. And if you have done it already, we're going to ask you to make sure you extend it to your networks. But Laura's question is, can someone comment on the fact that at the same time as the violence by COs has been exposed due to the accidental videotaping of the lynching of Mr. Brooks, there have been exposures of something incarcerated women know, that DOC's personnel have raped incarcerated women and engaged in systemic sexual abuse in many forms, along with the usual forms of violence by CO. Anybody want to comment on that question? Thank you, Laura.
Can I make a comment?
3 women in prison. And I remember visiting all 3 on several occasions when I was at the Correctional Association. And that was the theme every prison I went to. I believe at Albion, it went all the way up to the superintendent office where these senior staff were raping people, were convicted, went to court and were found guilty and still stayed there at the facility. So they had to see their tormentors every day. It was just incredulous. Like, what? So, can you imagine that? And then they don't have that many facilities, so they can't transfer people out or hide them, that type of stuff that they can do in the male facilities. But this is a everyday issue. Privacy, sexual harassment, every day. And I've seen it myself. You know, and very rarely someone like me would get a chance to go in a female facility and see this. But because of my unique position and because of Sophia, I had that opportunity. And I got to really understand what the women go through under these conditions. They don't get their sanitary napkins right now if they don't have them right now. You see? Forget being in touch with your family right now. You know, their mothers. Some of them have children in Bedford Hills with them. So some of these things are very dire, but it's not highlighted or spoken out enough. And I'm thankful I had that opportunity to see it. And I always wrote about it when I had the opportunity, the conditions that women were facing.
Thank you, Muhammad. Sophia, you want to?
Yeah, I wanted to add, and thank you, Muhammad, for that. I wanted to add to that to highlight how the complete disregard for what women experience while incarcerated. Governor Hochul appointed a new superintendent to head Marcy Prison, where Mr. Brooks was murdered. And that person that she appointed is currently the respondent in two, not one, but two civil suits for raping women while he was an administrator at a women's facility. That's not hidden. It's ongoing court cases right now. And still, he's appointed to be the head of Marcy Prison. So the so-called effort to make things better at Marcy, it couldn't be more of a hypocrisy.
Thank you. Thank you for that. We want to, before we close out, give you all some marching orders. If you are feeling outraged, if you are feeling frustrated and you are prepared to make some moves, we are going to give you some of the tools to do so. I'm going to turn it over to you, to Brother Muhammad, so that you can help give folks these marching orders. And we're going to put some of these links and stuff in the chat while you talk. But to close this out, Brother Muhammad, can you please share with us what people need to be doing? How can people get plugged in?
As Jamel said earlier, we need to get involved with some of these advocacy groups. Get in where you fit in. You also need to get to know your state senator and assembly person. The reason why I say that, because every time you see them, remind them of Robert Brooks. See, we got to have a constant reminder because we don't control the narrative in the news. So we have to be the news. And this summer, as the session ends, they're going to be what they call in district. So you can go to their office in the community. Take advantage of that. Believe me, that goes a long way. A third thing, in our links, we have links there for most of the advocacy organization, RAP, for elder parole and fair and timely parole. Please sign on to that petition. We have CA with a petition asking you to sign on, and the letter goes to Kathy Hochul about the Robert Brooks incident. I believe we have one from Cattell that's asking you to sign on to a petition that goes to Kathy Hochul about Robert Brooks. The more that she hears from people concerning this issue, the more she can't put it aside or try to divert it. It's up to us, the people, to be able to be a thorn in their side. And these is what we call easy asking steps. You see, or you could do that from your phone, from the comfort of your home on your laptop. And all you gotta do is click on. But eventually we're gonna ask for some other action steps. But maybe we physically will have to be there at a rally or at a protest. But we're letting you know that get in where you fit in. Because everybody can play a role, everybody. And you know what role you can play. Everybody can't go to a rally. Everybody can't go to Syracuse. Everybody can't go to Albany. But you can make a phone call. You see, you can email. Everybody can play a role in this battle. Everybody's being deputized and being part of this army. So join on to an organization that's doing this work. And the organizations that I mentioned, they out here every day. They out here every day. See, if they can get paid the salaries of the work that they do, because they're doing what you call yeoman work, an uphill field battle with a backpack on and very few ammunition. But the commitment and the heart and the will carries them through. So please join on to an organization, get on and link on to those links that we put in the chat, and continue to stay tuned and keep your ear to the ground because there's much more to come. I thank all of you for participating tonight, to coming on and taking time out of your busy day at the end of the day to hear, what we have to say, but it's imperative that we do so. We have to stay in touch. We have to be each other's brothers and sisters keepers, particularly in this time today. Thank all of you once again.
Thank you.
Peace.
Thank you, Muhammad. Michelle, any closing words before we close out?
No, like Muhammad said, thank you. You could have been anywhere in the world, but you are here with us. I just want to highlight one of the links that Lumumba put in the chat for our healing retreat. Sign up March 29th. There's going to be a lot of things going on, arts and crafts, haircuts, some relaxation that I was telling Jamel that he needs to do. So sign up for that retreat on March 29th. Back to you, Lumumba.
All right. Folks, we are just starting. I always use this analogy that what we're living in right now seems like some kind of sci-fi movie, and I always liken it to the Star Wars trilogy, and what we're feeling is what was like the Empire Strikes Back. Well, we the Jedis, and we're getting our stuff together. We are getting in formation. We are planning for a longer trajectory of struggle that we know will be victorious. And so do not fret, do not allow this to continue to beat your spirit down. What they're doing is intentionally overloading us so that we feel like this is unbeatable, but we know that victory is certain because we will make it certain. Thank you all, and we will see you on the front lines. Everybody have a good evening.